Hello everyone and welcome to Module 3. So this is the first week where we're really going to discuss a specific unit and a specific specialty, and that is going to be cardiology. So with that being said, this week we have two chapters we're focusing on. We're going to focus on all of Chapter 27 and all of Chapter 50. Now these are jam-packed chapters, so we're going to go ahead and just jump right in and get started here. So Chapter 27 is discussing your cardiovascular system, which consists of the heart, blood vessels, and the blood. So let's take a deeper look into each of those individual pieces. The heart is responsible for the movement of blood through your body and providing oxygen and helping to remove waste. The heart has a 4-chambered pump and it's located in the chest to the left side, beneath your sternum. The left and right side of the heart are separated by a wall called the septum. The right side moves blood from the body to the lungs, and the left side moves blood back to the body from the lungs. The two upper chambers of the heart are called the atria, and the two lower chambers of the heart are called the ventricles. Your heart has 3 linings: the pericardium, which is the outer lining, the myocardium, which is the middle layer, and the endocardium, which is the innermost lining of your heart. The blood vessels are formed to help make a closed pathway that carry blood from the heart to all the cells of the body and then back to the heart again. Your blood vessels consist of arteries, veins, and capillaries. So now that we know what's all included in the cardiovascular system, we need to discuss how blood flows from the heart. So first and foremost, blood from the body enters the right side of the heart through 2 large veins, either the superior vena cava or the inferior vena cava. Blood from the superior vena cava comes from the head and upper chest area, where blood from the inferior vena cava comes from below the heart. The right atrium receives all the blood delivered to the heart from the body, and then the right atrium pumps the blood through a valve into the right ventricle. That valve will connect the right atrium to the right ventricle and is called your tricuspid valve. The right ventricle will then pump blood out through the pulmonary vein to the pulmonary artery, which carries blood to your lungs. The blood is circulating through the body. It gives up its oxygen to nourish the body's cells, but at the same time it takes on waste carbon dioxide to given off by the cells. When the right ventricle pumps this blood to the lungs, there is a gas exchange. Then the pulmonary vein carries the oxygenated blood from the lungs and empties it into the left atrium of the heart. The blood leaves the left atrium through the bicuspid valve to the left ventricle, which is also considered the powerhouse chamber. The blood then leaves the left ventricle through the aortic valve and enters the aorta, which is the largest artery in the body. From there, the blood begins its journey through the various arteries that branch off into different regions of the body and wind up back in the heart through the superior or inferior vena cavas. So again, making that closed loop back to the body. Alright, so now that we know how blood flows through the body, we need to discuss blood itself, the functions of blood, and the different blood types. Blood is a type of connective tissue that is composed of blood cells, the formed elements of blood, and plasma, which is the liquid portion of blood. The average adult approximately has 5 liters of blood in their body. And there are 3 main blood cell types: erythrocytes, or red blood cells, leukocytes, or white blood cells, and thrombocytes, which are also called platelets. And blood has 3 main functions. It will either transport, regulate, or defend. When blood has transportation, blood moves from the heart to all the tissues of the body. The blood transports oxygen from the lungs and nutrients from the digestive tract and delivers these to the tissue cells. The blood also picks up waste materials from the cells that is later filtered and excreted from your kidneys, as well as the carbon dioxide that is exhaled from your lungs. To help with regulation, your blood actually helps to regulate your body temperature by absorbing heat. It also helps the body regulate the pH balance of the body. And finally, with defense, your leukocytes, or white blood cells, actually defend the body against pathogens such as bacteria or viruses. Now, in speaking of blood types, this is determined by the presence or absence of certain antigens and antibodies in the blood. Genetics also help to determine whether these protein molecules will be present or absent. In order to determine your blood type, we use an ABO blood group system to identify, and that has 4 blood types: type A, type B, type AB, and type O. Type A blood has A antigens on the surface of the red blood cells and the anti-B antibodies in the plasma. This means that they can only receive type A blood. Type B has type B antigens on the surface of the red blood cells and anti-A antibodies in the plasma. They can only receive type B blood. Type AB is the type that has both A and B antigens on the red blood cells and neither anti-A nor anti-B antibodies in the plasma. They are considered the universal recipient because they can receive all types of blood from the ABO blood types. Type O is neither A or B antigens on the red blood cells, but has both anti-A and anti-B antibodies in the plasma. They are considered the universal donor because their blood can be administered to most people regardless of the recipient's blood type. One other piece that we need to focus on is the Rh factor. This is based on an antigen first discovered in red blood cells of rhesus monkeys, hence where the name comes from. Someone who is Rh positive has red blood cells that contain an Rh antigen. A person who is Rh negative does not. The Rh factor plays an important role when it comes to pregnancy. If an Rh negative female conceives a child with an Rh positive male, the child has a 50-50% chance of being Rh positive. This means that the blood of the fetus will mix with the mother's, and the mother will develop antibodies against the baby's red blood cells. Because it can take time to generate those antibodies, the first child will not be affected. But if a second child is conceived, the baby's blood will be attacked by the mother's, and this can lead to a serious condition. But this condition can be prevented by giving the mother a drug called RhoGAM to help counteract that. Last thing I wanted to talk about was some of the different disorders that could be associated with the cardiovascular system. I will leave this for you to read on your own. All right, let's talk about Chapter 50, which talks about the electrocardiogram. Now, because coronary artery disease is the leading cause of death among both men and women in the United States, it is important that we help to catch and correct cardiac issues as soon as possible. As a medical assistant, we play an important role in helping with the diagnosis and assessment of cardiovascular disorders, like with the use of blood pressure and pulse. When more specific cardiac information is needed, we will perform an electrocardiogram, or you may also hear it as an ECG or an EKG. This is a procedure that records electrical changes in the heart. It was invented by a Dutch doctor, Wilhelm Einthoven, in 1903. When the ECG equipment senses an electrical charge in it is recorded on a readout as either an upward or a downward deflection from a horizontal line. Upward would be positive, downward would be negative. So now that you understand what an ECG is, we need to discuss polarity on the cardiac cycle. The cells of the myocardium produce electrical charges as a result of polarity. That simply means that there are two separate poles. One is positive and one is negative. Now the SA node, or the pacemaker of the heart, is where this all takes place because it controls the myocardial polarity. When the SA node initiates electrical activity, the atrial cells become depolarized, meaning the internal negative charge is reduced and the differences in charge inside and outside are lost. That electrical impulse travels from the atria to the ventricles, and those depolarize. As the cells depolarize, the atria and ventricles contract, and blood is pushed out of the heart into the cardiovascular system. At the end of the contraction, the myocardium relaxes, and rest is known as repolarization. One depolarization and repolarization equals one heartbeat. So now we need to understand how to read an EKG. A normal cardiac cycle is traced on the EKG as one set of PQRST waves. The P wave represents the atrial depolarization or the contraction of the atria. The QRS complex represents the ventricle depolarization or the ventricles contracting. And the T wave represents the repolarization or preparation for the next series of complexes. So now we need to discuss the importance of placing the leads or sensors. The ECG machine records the cardiac cycle through 10 sensors or electrodes that are placed on a patient's skin. You have the right arm, right leg, left arm, left leg. The right arm would be on the upper part of the arm, but the right leg, this sensor, serves as an electrical reference and does not actually get used in the recording. All others will. V1 through V6 are going to be placed on the chest. And you can see here on the slide, I actually have put where those are, as well as a nice little picture for you. I know this is something that you will be doing in your lab classes this week, so pay very close attention when they talk about them in your lab classes, okay? Now, as a medical assistant, it's your job to also prep the patient. That means having them remove any jewelry, especially if it's metal, removing clothing from the waist up. Please offer them a gown to keep their modesty. And then you'll also have them laying in the supine position if it's comfortable for them. If it's not, you'll want to place them in a semi-Fowler's. All right, guys, that's what I have for Module 3 and the topic of cardiology. This week, you do have a discussion post again, which is dealing with artifacts and troubleshooting an EKG. So you'll want to make sure your initial discussion post is completed no later than Tuesday, July 18th by midnight, and that you have at least one reply post to a classmate no later than Saturday, July 22nd. You also have one written case study assignment, which is based on coronary artery disease. Again, you'll have a scenario, and with that scenario, there are 5 questions that you will need to answer properly in an APA formatted Word document. Again, that means that you will need to have a cover page, a reference page, and your in-text citations. If you have any questions or comments, concerns, please make sure that you are reaching out to me as soon as possible. My direct line to the Rockford campus can be found on your course homepage on the top right-hand side next to my photo. You can also email me through the course messaging in Blackboard, and I will respond to you as soon as I see it. Have fun with cardiology, guys, and I'm very excited to see what you guys will come up with for your discussion board and your case study. Bye, guys.